Matthew Beinhauer. I was having random facial pains, kind of like buzzes or kind of like electric shocks in my jaw. It felt like dental pain where your wisdom teeth would have been. And so I went to the dentist. The dentist couldn't find anything wrong with me. I insisted that it was dental, and he kept saying no. I went to my regular doctor, and they both told me to see a neurologist. So I saw a neurologist who basically told me he thought I had trigeminal neuralgia, which he said, worst case, I have it and there's nothing that I can do. And then the other option would be we would get an MRI and it would show something pressing on the nerve, and then maybe it would be something that we could take care of. We got the MRI, it came back. It turns out that I had an Epidermoid-cyst, which apparently I've had my whole life, and it just took my life to grow to the size that it was and started pressing on the nerves and affecting the nerves. I went to see one surgeon, and kind of scared me, the whole process, and I didn't really know what I wanted to do, if I wanted to go through with surgery or kind of just, take my chances with the pain or see how it would kind of change. For me, I was really scared and didn't want to do it, and when I saw Dr. Lee, I knew that I did, and he made me feel comfortable with him, and I was so confident in him. When I walked out of Dr. Lee's office, there was no question that I was going to have it done, and I was ready to schedule it immediately. About a month later, I ended up having the surgery with Dr. Lee, and he took out, I think he said about 99% of the cyst. There's a few small pieces that remain in there. And I mean, a week after surgery, as soon as my stitches came out, I felt completely back to normal. I mean, I haven't had any side effects, maybe a baby headache here and there, but not even anything that I would take any medication for. So I mean, I've been running and working out again, and I mean, I had the surgery, I think it's been about a month now, and I mean, I'm doing everything that I did before surgery. Penn has a pretty good reputation, and when you start going through something like this, people that don't even have necessarily like direct experience with something like this, the first thing they say is go to Penn. It's definitely scary, knowing that something's in there that's not supposed to be in there. The most basic advice I would say is just go see Dr. Lee and have him take care of it. But